5 principles of a trauma-informed approach. Empowerment. As we find ourselves still coping with the pandemic, the principles of trauma-informed care can be used to develop our organizations in ways that empower workers to better support quality of life for residents and clients. Empowerment is one of the 5 principles of a trauma-informed approach. The principle of empowerment is validation and affirmation that you are making appropriate choices or moves with the context and information that you have. As we continue to navigate the workforce struggles of turnover, burnout, and staffing, we can't forget to acknowledge the persistent challenges for workers in terms of pay, benefits, workload, and emotional exhaustion. We need to work hard to support workers in ways that empower them to not only build empathy and creative problem solving, but also build fulfilling and meaningful careers. In the culture change movement, we often talk about empowerment at the individual level, which means workers are empowered to make decisions on the spot and adjust to the needs of the moment. Senior management and person-centered organizations make sure that workers have the knowledge, information, training, skills, resources, and supportive environments to confidently make independent and informed decisions. One important way to empower workers is for organizations to create structures that give them access to more resources, including career mobility and educational opportunities. One option is to provide in-house educational offerings. This typically requires education release time, meaning that staff are allowed to take time away from work to attend in-house educational offerings and are compensated for their time. Allowing workers educational release time during work hours requires a plan for staffing so that others can fill in for workers who are not on the floor because of training. Another approach to promoting ongoing training and skill acquisition is to develop direct care and support associates in the role of lead workers. Lead workers make sure their colleagues have learned the necessary skills by relying on skill checklists. Pathways to lead worker roles could include roles such as electronic health records lead, scheduling lead, education or training lead, engagement lead, or retention specialist. If you do not provide in-house educational opportunities for new roles, there are still ways that you can help workers obtain additional training. One way is to provide affordable employment benefits for workers who are working less than full-time when they are in school. School requirements often make it difficult for workers to maintain full-time employment. Sometimes, even if they can manage with reduced wages, they still depend on employers for health insurance. Allowing workers to maintain benefits, especially health insurance, at reduced hours supports workers as they continue their training. Tuition reimbursement or remission is another practice that can help workers pay for additional education. Tuition remission typically involves an arrangement with an educational institution where the employer directly pays tuition for the employee. This helps workers who cannot afford the upfront cost of tuition, even if reimbursement could be provided later. Many tuition reimbursement or remission policies require that workers are enrolled in a degree program, but this often limits the educational offerings they can take. Creating the opportunity for workers to take continuing education and appropriate certifications will enable them to improve their skills in ways that are valuable to the organization. When workers complete additional training, it is important to recognize and reward their skills with promotion opportunities. Empowerment occurs when workers know their pathways toward advancement, feel supported in developing new skills, and have others affirm their value to the organization in words, practices, and organization-wide policies. With empowerment, all members of the community have the ability to make decisions, engage fully, and participate regularly in quality improvement processes throughout the community. What will you do to empower workers in your community?